Well, one of the challenges of delivering a modern physiotherapy course is making sure that that practice is underpinned by good, solid scientific evidence. And here at Brunel, you're going to be taught by a bunch of active researchers in their field who are currently publishing in high-impact journals internationally up-to-date research about physiotherapy practice.
Okay, Rory, can you show me how you would test the medial meniscus?
Okay, sure. Well, the first thing I'm going to do is bring the knee into flexion. I'm going to have lateral rotation, and my hands on the medial side of the knee, and I'm bringing the leg from flexion to extension, just like that.
Excellent. And can you tell me why you're adding adduction and lateral rotation to your test?
Because it's compressing the medial compartment of the knee, and it's putting strain on the medial meniscus, which would then cause pain in the test.
Excellent. My name is Arturo Lawson. I'm one of the lecturers in the physiotherapy division at Brunel University. I teach some physiology, and my field of expertise is musculoskeletal. My working life involves considerable clinical work as well, which means that I bring current and contemporary clinical experience into the classroom and relate real-life cases to facilitate the learning process for the students.
We're going to have a look at the functional anatomy of the cerebellum. This is a very schematic diagram of it. And as you can see, we have the body of the cerebellum that's divided into 3 distinct functional regions. And we have a further part of the cerebellum under here. And that's the bit we're going to start with. Okay? So who can tell me something about this section here?
So that's called the flocculonodular lobe.
That's right, yep. And what happens with that bit?
The flocculonodular lobe, that receives primarily vestibular input, which is responsible for balance and coordination in head and eye movements.
That's great, well done, good. We're going to start off medially, and we've got these nice 2 longitudinal furrows which depict the margins of this raised central... My name's Betty Cassidy. My clinical area of expertise is neurorehabilitation, and I use that in my teaching on the neuro modules on the undergraduate course. My teaching is also informed by the research that I'm currently involved in, which is looking at the lived experience of people who have a condition called cerebellar ataxia, which makes them have problems with their walking and their speech, and we're looking into what that means to them and how physiotherapy can help.
They've fallen over, they could be by themselves, they may not be able to get up, and that could be the case for many hours or even longer than that. So they are very, very scared. Now, some people have had a history of falls. They may have fallen recurrently. So these are the people we need to capture for rehabilitation, okay? And what you need to do is not to put them, start off in the position that they're frightened of. Because they're going to feel frightened when they come to you for treatment, if that's where you start. I'm Alison, I'm a lecturer on the physiotherapy degree programme at Brunel University. I've got extensive experience in clinical practice at specialist level. I've been teaching, and I've also been involved in curriculum development.
What I want you to do for me is just gently swivel your hips forward to the edge of the chair.
We've formalised professional development within the course. We feel this is very, very important. It has significance and it has real value because we want our students to be able to be highly employable and to be able to work at a sophisticated level and do very well in their clinical practice at the point at which they graduate. If the patient is now ready to go on to the next stage, you need to teach her how to do it, okay? Off you go.
All right, if you could start from the backwards position, we're going to take this away. All right? And again, I want you to just shuffle your hips forward to the edge of the chair. All right? I want you to just turn, twist your hips facing me. If you could place both arms in front for support. Bring this knee all the way down this time and just bear weight on. Okay? From that position here, what we need to do again is push up through your arms, really push up. That's good. And then sit yourself back down.
I'm Dr. Mandy Jones. I'm the 3rd year coordinator for the BSc Honours Physiotherapy at Brunel University. And I also lead the Level 1 respiratory module, which covers the physiology, the pathophysiology and the management of a wide variety of respiratory diseases. And what might be perhaps your first line intervention with a patient?
My first option would be to use the lower thoracic expansion exercises of the active cycle of breathing technique.
Brilliant. Well, we've got our model sitting there. Could you show me what you would do?
Yeah, sure. So what I would do basically is I want her to take a deep breath in I wanted to increase the volume from the lower part of her lungs first, and then her chest afterwards. So what I'll do is I'll just put my hand just underneath your chest, and I want you to take a deep breath in your own time, and make sure that my hand, and hold it, sniff in a bit more air, and release.
My current research focuses on the management of dysfunctional breathing, and with a couple of colleagues I'm undertaking 2 systematic reviews for the Cochrane database, evaluating the physiotherapy management of dysfunctional breathing, both in adults and in children. From a primary research perspective, I'm involved in a clinical trial with collaborators from other universities and hospitals in order to be able to identify the most efficient, effective way of repeatedly producing induced sputum samples. I really believe that my being both clinically active and maintaining a research profile really benefits the students. It enables me to embed the most current research into our teaching, but also to be able to explain it and teach them to use it in a clinically appropriate environment. There is a shadow.
I think the first thing that impressed me with the physio course was how well it's set up. The facilities here are amazing. The Mary Seacole building is practically brand new. The tutors and the lecturers are very easy to work with and very clear and always there to help. And as well, even just the quality of the teaching is very focused on what you do in real life. So I feel very confident once I get into placement that I will know what I need to do, and I'll do what I'm expected to do.